Hello viewers, I welcome you all to today's edition of our video session of our program, The Health Center with us Young. Today we'll be treating stomach ulcer. Of course, we have done the live session of this program, but this time we are going to present as a routine the more articulate video session that helps in educating more people who are unable to get the most of the information that is required during the live session. Because the aim of this program is to help educate everyone, no class, ensure that everyone understands any disease that we take up to discuss, so that we can all make attempts and be free from certain diseases that are preventable, manageable, and treatable. So thank you for being with me today, and please pay attention as we discuss stomach ulcer. Stomach ulcer is a condition that disturbs, or rather a lot of people suffer today. So many people suffer from this disease because some places they do not treat this very well. Hence, people suffer from it out of ignorance, and it takes long to be treated when it is supposed not to have lasted as long as it is lasting. So we start with asking ourselves, what is ulcer? Ulcer is a condition in the stomach. Is a condition where a wound that exists anywhere refuses to heal. So we call it sore, a sore that refuses, or a stubborn sore. So it is not actually that it takes that long. That's why it's not just a chronic sore. There are certain ones that can be chronic, and that is the situation where I'm explaining now, that people have certain sore that refuse to heal to a long time, and they think that ulcer is not healed. No, ulcer is treated, my people, and we have to understand how it is medically treated. If you have any other means it is being treated, I don't know about that. But I will tell you what causes this ulcer, how it is treated, and how you can live free without having any exacerbation of it. So, in this particular type of ulcer, we are treating stomach ulcer. It's not the ulcer on your hand, it's not the ulcer in your legs. Stomach ulcer is the ulcer that occurs inside of your stomach. You know the stomach, like you see in the screen, the shape of the stomach, how it is in the body. The stomach is an environment that thrives everything in it in low acidity. How do I mean? Stomach is an acid environment that helps in digestion of food. So as the food passes through the food pipe, comes into your stomach, it meets an acidic environment that now gets it, helps it digest and go down to the small intestine, to the large intestine, just as you can see on the screen. But then, this acidity has a certain level or degree to which it is supposed to stay. It's not supposed to be too acidic as to become a problem to the individuals carrying this stomach. And that is how nature maintains it, through the system you have in your body. So your body, as much as the stomach has to be acidic, it's not supposed to be too acidic. That is why when you take anything that will make your body to be, your stomach to be more acidic, you will feel it, especially when you have no food in your stomach. Imagine when you eat, don't eat in the morning and take pineapple, lemon, orange. What do you feel? That is a feeling of acidity in your stomach. Then imagine when you now added something like coffee, caffeine, like taking cola. The degree changes. You feel bad, as if there is something irritating your stomach. That could be that. But then, what causes stomach ulcer? Stomach ulcer is caused by two major things already identified. One is an infection of a bacteria known as H.Pylory. H.Pylory is a bacteria that thrives in an environment of alkalinity. But when you are infected, maybe by where you use the toilet, or because sometimes it could be around your body looking for a way to harm you, but it cannot harm you in that area. Maybe it's just something you have it normally around your body, because it might be just like you have staph on your body until it becomes a pathogen, which is an environment, becomes conducive in a certain environment to eat you up. So in that stomach is a conducive environment for it to eat you up where the acidity is low. It becomes alkaline. But if it finds that environment conducive, it goes to cause more harm to you by irritating your stomach mucosa. That's the walls of your stomach. When it bites it and bites it and bites it, it irritates it, and to that extent breaks a certain pore where acid flows into the stomach. This acid that comes out gradually is now made to flow at a higher degree. And when it flows in at a higher degree, the place becomes more acidic. Now you think of the life of the animal, the pathogen. It goes into the holes that it has dug and hides, producing something that helps make the environment alkaline. It produces, that is called urease, which makes the environment alkaline and makes it to hide. And then when it now hides, the acid begins to flow. And when the acid is flowing, it does not affect it again. It now affects your stomach, and you now have the symptoms of ulcer. You cry, you do every other thing, it is still there. It doesn't die because it has built a kind of a cyst that covers it to thrive in your stomach while you die of what it has allowed to flow in. Those are the things that the doctors now go to treat. They go to treat the acid that is disturbing you, which could equally cause you acid reflux if it continues for a long time, because it means that it's now flowing into the esophagus, the food pipe. And as well as looking for that pathogen, I'll call it an animal at this stage, a bacteria, to kill it with a different medication. Both of them require different medication, treating the source of the pump of the acid and treating the animal that caused the acid to come out. So, what are the symptoms you see when someone is having this condition? Several symptoms: the pain, the belching, sometimes it can it produces blood that you pass through your faces. A lot of other symptoms comes with this, caused by this irritation, by this bacteria. Another thing that causes this is medication known as NSAID. Certain medications like Tylenol, paracetamol, ibuprofen, aspirin. Those medications can irritate your stomach to the extent that they begin to cause these things, cause this irritation, causing you bloating, belching, even nausea, vomiting, this ulcer, and that you can even produce blood. So to avoid this, diagnosis has to be, when these symptoms are there, you need to be diagnosed to find out whether it is ulcer. And there are different types of diagnosis that should be done to find out. There are a breath test, because the main cause of this is that H.Pylory. You do a breath test to find H.Pylory. You do also blood tests to know if you are suffering this based on autoimmune, because some people's body reacts that it causes, they have that kind of irritation in their tummy all the time. So, and in that case, it is not the bacteria that is the case. But most often, when you are having that kind of thing, the pH value of your stomach, which means whether it's acidic or alkalinity, it changes. That this animal or bacteria will come to find a way there. So most times, whether the medication or not, H.Pylory tries to come to hide and cause you more harm. You could equally use upper endoscopy to find a camera going through here to determine whether you have this disease, as well as upper GI exam. So when these are done and found that someone has ulcer, it comes to the treatment we're talking about. So remember, the treatment I'm talking about is the acid that is causing this, and if the pathogen, the bacteria, H.Pylory is there, which is almost always there, which is always there, then it has to be tackled. Meanwhile, for this condition to sustain, there are certain things that people do that make it exacerbate, aggravate. Drinking of alcohol helps make this, especially when the alcohol has come to a certain level. A little alcohol may ameliorate or reduce the acidity of the thing, but it does not kill the H.Pylory. And alcohol, besides the stomach, has other dangers in your body. So most times and always, as you hear, alcohol is always advised that you quit. So alcohol aggravates when it becomes overloaded. Then smoking can as well cause you that, aggravate that to a certain degree. Caffeine can do this. Taking cola, of course, caffeine is in there. Some fruits, like irritant fruits, like pineapple, coffee, lemon, orange, and some other acidic fruits will equally cause this to aggravate. So what do you do to treat this? Immediately this is found, medications has to come. Medication that will address closing the source of this acid has to come to play, which is often the gold standard medication is the proton pump. That is the one that comes. There are two medications that can work on this. One is the antihistamine that blocks the source of this acid, but most times the best one that works is the proton pump, which there's a pump that increases the flow of this acid into your stomach after it has come out from the source. That pump that increases the flow of the acid is being blocked by a certain medication known as the proton pump inhibitors. So what it does is that it closes that place up and the acid will not be flowing in again. And certain medications include the pantoprazole, the omeprazole, and the rest of them. I hold it there because you need to see your doctor. Don't start writing down the medications. Don't say I tell you, but know this for those who equally understand medications and their rights very well. And the environment you are, if it allows you to buy over the counter. So the other side of it is, what are you gonna do to this animal or this pathogen? It needs antibiotics to be treated because it's a bacteria, and that antibiotics most time you see the clarithromycin and amoxicillin coming to play with this, because one antibiotics is not always recommended. It's not even recommended for treating this. So this is how it goes, and the treatment continues. So without taking this video too long, but I need to be more detailed about it to help our people reduce the risk and as well as treat this disease and understand what it is. The symptoms have been explained, the aggravating factors, the medications. Then what will happen if you don't treat this disease very well? Complications. If you don't treat ulcer very well, you may end up having stomach cancer. Yeah, I won't hide it to say it because it means that the sore will continue to eviscerate, exacerbate, irritate, and cause more wounds and make your body more vulnerable and susceptible to different conditions that will be more severe. This, no one would want to see, hear, or experience, and that is where I will urge you. Whenever any kind of symptom like this comes, go see your doctor for treatment to begin, so that you will avoid, so that you will avoid falling victim of this kind of thing we're talking about. It could equally cause you peritonitis, which means an inflammation of the part of your body, and that is it, with infection. It can equally cause you anemia, pernicious anemia, which happens in that parietal area where the stomach lies, the place where that produces some essential things that the function of the stomach that helps in producing synthesizing vitamin B12. And you know the absence of vitamin B12 in your body would start to cause you certain problems with your nerves. That you wouldn't want to see. So without going too far, I would like us to finalize this by knowing that certain things mentioned here should be carried out for us to be able to avoid having this disease, because some other factors might trigger this, might aggravate this. If you know these basic things, it will be very helpful for us to live better without having to experience ulcer in a way that will be thinking that, hey, this disease is incurable. No. Know it that it can be cured. And when it is being managed, for someone who hasn't seen the doctor, you can be taking antacid just to hold your peace when the pains are coming. So I'll urge you, do not even rely on certain kind of treatment. Meet your doctor, because the prognosis will be very bad if you don't do that, so that you'll be well treated and have a better life. We can only do what we can do by passing the information. It is left for us individually to do our best to ensure that we live better, because health is wealth. Thank you. Have a great day. I remain the anchor of the Health Center with Ozion the Expressionist.